Hi, everyone. Welcome back to another episode of the Slimming Surgeon podcast. I'm your host, Dr. Candace Kickler. Today, I have a very interesting guest. This is someone who I've been friends with via social media for quite some time now, and she is a specialist in the area of lymphatic drainage massage, and she has her own Medi-Spa, Body Krush, in New York City. So I'd like to welcome you guys. My guest today, Stefania. Stefania, I don't even know how to pronounce your last name, so I'm not going to butcher it.
It is Zoys. Thank you so much, Candace, for having me. I'm so excited. I've been following you for such a long time, and I just love what you're doing. So honored to be.
Thank you. No, thank you for coming on. I know our schedules are so crazy, so we have planned this forever, and I'm glad we're finally making it happen.
Yes.
So, Stefania is the founder and CEO of Body Krush. It is a Medi-Spa in New York City and Long Island with a focus on lymphatics and anti-aging and biohacking. She's a licensed medical esthetician and certified manual lymphatic drainage therapist, and she's been in the industry for over 10 years. So, Stefania, welcome, and tell me a little bit more about how you got into this industry.
So I actually started, I started my career in finance and I hated it. And I was always into health and wellness. I wanted to explore just the depth of what I can do for health and wellness. I went to a esthetician school. I worked for plastic surgeons. I'm an expert at laser. And I went to massage school. I have a certificate in lymphatics, and my market of clientele initially was really post mastectomy clients. And I was working with a lot of women that were going through reconstruction surgery. And a lot of it is harvesting skin from different parts of the body, fat transfers, things like that. And most of these women have had radiated skin, lymph nodes removed, and just lymphedema issues. So that's really the market of clientele I started working with. I feel like lymphatic massage has been around since the World War II era. Started in Europe, but it wasn't well known. I feel like in South America it was a thing. The lymphatic massages were incorporated post plastic surgery or just surgeries in general, but the awareness really in the Western culture wasn't there. So in specifically the cancer world, it was a thing. So as I just developed my techniques, opened up my med spa. A lot of my business is word of mouth referral, and then I guess the awareness of lymphatic massage and how important it is post-operatively, it just became a thing. Now I feel like everyone's doing lymphatic massage, and everyone knows about it, and it's for detox purposes, for general wellness, but my practice kind of evolved, and now I'm pretty well known for what I do. I mean, I work with a lot of top plastic surgeons in New York City, LA, Miami. And yeah, that in a nutshell, that's my background.
That's amazing. I'm a big fan and proponent of lymphatic drainage massage after surgery. And, you read the literature, it supports it. But for me, it was about seeing my patients in person, the ones who got massaged and the ones who didn't.
Oh yeah.
The last practice I was in, we didn't offer in-house massage or we didn't have anyone we specifically referred people to afterwards. But I, almost through trial and error, found some really great providers locally. And it's something I swear by now, especially if you get, body contouring, like liposuction, tummy tucks, things like that. It's a game changer.
1,000%. So I think a lot of it has to do with trust. You have to trust the practitioners you're working with. There's a lot involved post-surgically with incisions and infection control and things like that. And not everybody works the same way. So I think the number one, a lot of the doctors I work with, they have a list of providers that they know and they trust. And I work with plastic surgeons that I have their number. I text them when I'm with a client and I see something going wrong. I'm on the phone, I'm reporting, I think there's an infection, I think there's a seroma, there might be a hematoma. That kind of communication is really important. And when you think about post-operatively, I see clients more than the doctor sees them after the surgery. So it's really having that open dialogue and just knowing the surgeon, knowing the practice, knowing the nurses, just it really helps the overall end user experience, and like safety of the client and safety of everything. So it is important. It's just, I feel like a lot of times doctors are reluctant to promote the massages because they don't have providers that they trust. So it's better to just say don't do it than to say do it, even though it does help you. That's
Yeah, I do think that that is one of the issues with people who don't recommend it regularly. Maybe they've worked with somebody who called them too often, or, raised red flags when there wasn't anything going on, or maybe the patient had a bad experience. There are a lot of factors, and that's why I think opening the dialogue is super important. I mean, and similar to your experience, the people who've done massage for my patients, they have my cell, or they'll DM me, like not patient sensitive information necessarily, but they'll, update me, let me know how things are looking, all of the things. And I appreciate that, extra set of hands and eyes, because you're right. Like, we can't be at everyone's bedside all the time.
it's impossible. It's impossible.
So
So
let's go back to the basics though, because, obviously not all of our listeners are estheticians or plastic surgeons. So what, keeping it basic, like what's the lymphatic system and like how does it help to get a massage? Like, what do you tell someone who's like new and just interested in this service?
So, I mean, lymphatic massage is good just for general wellness. There's a lot of my patients that are non post op clients that come in for just general detox massages. They might have metabolic disorders, inflammatory disorders, lots of different things. So, like that, and for post op, I mean, the lymphatic system, the purpose of our lymphatic system is to manage the fluid balance between our circulatory system and the lymphatic system, which is its own circulatory system in itself. But primarily, focusing on immune function, fat absorption. There's a lot of fat absorption that happens through the lymphatic system, specifically fat soluble vitamins like vitamin D, vitamin E, and just cellular removal, like bad cells that are dead that need to be excreted through the body, cancer cells. Like there's a there's a fine line between, there's a lot of lymphatic masseuses that don't recommend lymphatic massage during like active cancer or even in remission of cancer, and then some promote it. I can't comment on that because I personally don't work with people that have active cancer, but there are so many studies that help, help those patients. But primarily just the fluid retention or immune response, two top topics that the lymphatic system helps. And then in a postoperative experience, our body's in a high rate of inflammation. So the body's detecting trauma. So
Hmm.
it's a voluntary trauma, but it's a trauma. So the body all of a sudden responds with this inflammatory response, the production of lymph. And when we are speaking in terms of like plastic surgery and people are getting lipo or tummy tucks, the process of lipo, our tissues are being infiltrated with tumescent fluid, which is, saline, numbing solution, all of that, plus our body's lymph. You need to excrete that. Our body, the overproduction of that fluid, it needs to be manually removed. There's no way that fluid balance is going to happen. Our body's in an overload. So what happens is if you don't manually remove the fluid, your body will just retain it. And you have excessive swelling, you have risk of wounds not healing or even incisions opening. If, like in extreme cases, some women get tummy tucks, they don't wear proper compression, they're not getting massages, and they look 5 months pregnant, and then their incisions just open. It's because it's like
Mhm.
you're busting at the seams, basically.
Exactly.
So the manual movement of that fluid is crucial. Most doctors use JP drains, which are, drains that are put superficially into the skin that allow, it helps the fluid come out. A lot of times incisions are left open. So when we massage, we have that fluid come through the incisions. Lots of different doctors work in different ways, but in a nutshell, that's the best way to explain it.
And I have friends who get lymphatic massages to like look great in a bikini the next day. Or, my friends who are models who are like in a show, they get a massage that morning or the day before. So it's not just for after surgery, like you hinted at.
Yeah, for general wellness, it's the best.
Oh, I don't hear her.
Can you hear me?
Hold on one second, Stefania.
I could hear you.
Okay, say that again. Sorry.
Oh, I was
Okay,
saying,
I'm gonna ask my question again. That way we can like crop it and paste it. Okay, so I have friends who, get lymphatic drainage massages for vanity. They're models or they're like high profile individuals who are going to be in an event or in a show the next day. So it's not just for surgery, it's also just to look good and to feel good as well, right?
for general wellness. I mean, it helps. So the fluid that we retain is in our interstitial spaces, which is in like a surface level of between our skin, our fat, our muscle layers. So the lymphatic function is supposed to excrete those trapped toxins, trapped fluid. But a lot of times, if you have a high rate of inflammation or situational, if you go out and you're drinking a little too much or eating high salt foods, you're going to retain fluids, and manually moving them and diffusing them to allow our body to absorb it is so necessary. So a lot of times models, if there's a photo shoot or you have an event and you need to fit into a dress, it really helps shed weight. It's water weight, but it helps shed weight because you are diffusing that fluid and allowing your body to process it and excrete it. So it definitely is amazing. And in that, our immune function, on top of that, things that are not meant to be in our body sitting in our tissues cause disease, cause problems, cause more inflammation. So getting it out is crucial.
So I'm going to ask you kind of two questions. How often or how quickly after surgery do you recommend getting a massage? And then for someone who hasn't had surgery, like how frequently would you recommend this type of treatment?
So post-operatively, it depends on the surgery and the procedure and if there's complications, and there's lots of factors to consider. But in a nutshell, if I had to, like, generally speaking, if you have liposuction and no major incisions, you should be getting your first massage within 24 hours post-op.
Hmm. Yeah.
Like, I had lipo a few years ago and I had my first massage like that night.
Yeah.
Crazy, but
I
like,
know people like freak out about that. And I'm like, listen, in Colombia, you would be going from the table to the massage. Like that's,
that's what happens. But
yeah.
pain. But the pain, and I'm speaking from my experience of having these procedures, the pain is almost like a good pain because you have
Hmm.
sitting in you and it hurts. But as you're getting it out, it's relieving as well. So, and then you feel so much better. And like day by day by day, it just gets better and better and better. So, having that anticipatory fear, it's like I always tell people, even if I get, when clients call me to book me and they're like, how painful is this? I'm like, trust me, you're not going to get it until you're in it. And then you'll realize like, oh my God, this was amazing. I needed this. Um,
Yeah.
if it's,
Everybody that I have that, gets this done, they all say the same exact thing. Like, I was so terrified. I didn't want to go. I delayed it by a week, but then it's like now I swear by them.
yeah. So if you're just getting lipo, I say like within 24 hours,
Hmm.
kind of major incisions like tummy tucks, I like to do 48 hours post-op, but we're really avoiding the stomach. Like stomach, it's
Yeah.
more just like a little brushing of the skin. I feel around for fluid. I really like my first session with somebody is really just creating a baseline of what my treatment plan is going to be. Everyone has a different post-op experience. Some people really retain a lot of fluid and they're draining for a long time. Some people don't. And we really don't know where you're going to be until you're in it. So creating that baseline and treatment plan is crucial. And then working off of that. And there's so many different stages of recovery in the massages and what we're doing and what we incorporate and what we implement. But really just creating that baseline, determining where we're at, and having like, a 30, 60, 90-day game plan of where we want to be is how I work.
I
Um,
love that. So, aside from using your hands, what other like tools and devices do you use during these treatments? Because I know people see online like, oh my gosh, they're using these crazy wood paddles and like spoons and stones, and I'm terrified. I'm like, no, no, these are good things.
I mean, everything is good at the appropriate time. I feel like the first 4 weeks post-op, you're really doing everything manual, everything by hand. Once incisions are closed and there's no signs of infection, there's no complications, then we can start incorporating things like ultrasound and radio frequency and even like the wooden tools. I use wooden and metal tools, and those tools really just help me get into a little deeper into the fascia. Sometimes after liposuction, even if you're wearing proper compression and you're getting your massages, there are fibrotic areas.
Hmm.
I hate using the word fibrosis because it's like
Yeah, because it freaks everyone out,
but it's
but
not
it's
like fibrotic
real.
tissue. It's just like, your body as you're healing creates an inflammatory response and it creates a little bit of a hardening of a tissue. Oftentimes I find like the flank area after flank lipo, you get some fibrosis. Sometimes arm lipo will create that. But we use the tools to just kind of massage more deep into the fascia to break it up. So it's not painful. It's actually so good. It feels so good. But I use tools. I use ultrasound sometimes if I have people that have
Mhm.
really bad fibrotic tissue. It softens the tissue up a little bit, helps us massage it out. And I start incorporating radio frequency usually between 6 and 8 weeks. And RF really basically, it's just heats the skin to a certain temperature that allows for neocollagenesis and skin retraction. So I use it to just assist in the cellular turnover, renewal, and tightening. Most doctors are using Renuvion in conjunction
Mhm.
with the lipo, um,
Right.
the skin tightening, but even if they're not, the radio frequency really helps with that.
Totally. And I think that's important, to understand that there are different modalities that you offer or that certain providers may or may not offer. And going to someone who is well versed in all of these things, buzzwords, ultrasound, radio frequency, like manual lymphatic drainage, like these words, if they don't know what they are, they're probably not the right provider for you in a post op setting. Day to
Right.
day, whatever, I think, but post operatively, you've invested so much money in your plastic surgery and your recovery. You want to go to someone who's knowledgeable.
Of course. And there's a time and place for everything. So a lot of times we live in this social media world where everyone's on Instagram and everyone is just like drawn in. If you have a great Instagram and a great following and great videos, people think necessarily you're the best. Like you really have to understand why these modalities are incorporated into a session and why they're used. It's not just about going somewhere and saying, oh, I'm getting XYZ. It must be good. Things have to be done for a reason. So doing things too soon can actually set you back in recovery. Using radio frequency too soon can actually
Mhm.
like fibrotic tissue harder. So like there has to be knowledge behind it, but my approach is very conservative. Safety is my priority and like slow and steady. Recovery is a slow and steady journey. Nothing happens overnight. And I try to remind people that all the time because people want immediate gratification. So it's hard to convey that, but slow and steady is the game.
I love that. So I'm going to ask you like one or two more questions, and then we're going to kind of set aside time for a second part to this episode. So if you're listening right now, like this episode is really focused on lymphatic massages, post-operative recovery. We're going to talk a little bit about garments, and then we're going to have a second part, which will release a week from now. And this one's going to be a little bit more on some of the like other things that we're into, like anti-aging, some biohacking, some peptides, like all the other things that can be combined with your wellness routine. So Stefania, you have a garment company, is that correct?
I do. It is called Krush Shapewear, and it kind of was born from for the need of compression that actually is functional. And so for a while, a lot of people would ask me, Stefania, where can I get a great compression? Where should I get one? What should I buy? What do I need? And I was referring people out to like, oh, go to this brand, they have this. Go to here, they have that. And I just decided, why don't I just come up with my own brand, work with the factories and design things that really are missing in the market. And that's what I did. And so now I manufacture everything Colombia. Everything's Colombian made. And Colombian made fajas are the best. I don't care what anyone says. They just know how to do it and they do it right. So yeah, everything's made in Colombia. I have I don't want to say proprietary collection because I mean faja's a faja, but I have certain details in my fajas that just help the recovery process. You're wearing these fajas for a long time. They have to be
Yeah.
comfortable. They have to be functional. You don't want to feel like you're annoyed every day wearing this. So that's what I kind of created. And it's a thing. People are happy. They're great quality. They do not stretch out. That's another thing with garments. A lot of times you're wearing them all day. You're washing them pretty much daily. People usually have several garments and they rotate through.
Mhm.
You need something that maintains a shape and maintains compression. And mine do. And it's been good.
I love that. I mean, I'm a big garment girl myself. Like, I see the benefits of them in patients and I wear them myself. Like, and for me, it functions as like, it helps me hold my abs in. It keeps my waist cinched, it reminds me not to overeat. It sounds
The baby.
crazy, but it works.
It totally works. Yeah, they're so important in your recovery. I mean, it just keeping swelling at bay. Even like a lot of people think that they're going for lipo, they're getting a tummy tuck, and they're going to have this perfect hourglass body. That is so false. I mean, the muscles are plicated and the fat is being removed, but you kind of look like SpongeBob for a little bit. You're very slick
Yeah.
and you need to
Yeah.
work that waist. So
Yeah.
massages help with that tremendously. And the compression and just having like the compression is meant to mold to your body. So like you put
Mhm.
it on and it kind of takes shape and the corseting of it, you go smaller hook, and it really, really helps with your shape. And um
I mean, I agree 100%. And I feel as though it's also helping to retrain your muscles. Like your abdominal muscles, it's not just one. You've got 3 different layers all working in different dimensions. When we do an abdominoplasty or a tummy tuck, we're coursing you up in the middle, like basically in one dimension. So we're bringing your waist in, but we're not, addressing all the layers circumferentially. So for me, putting on a garment that's compressing you 360 is going to help to remind your muscles to be held in more tightly all the way around, not just in the middle. And that's where I feel like there's a long-term benefit to using them and training your abs to stay, contracted or to stay like sunken in, if not
yeah.
for lack of a better word. And that's why like I wear one myself because I see the difference. If I go a couple weeks without wearing one, I feel like I'm getting this mom pooch versus if I'm wearing my garment, not necessarily every day, but regularly,
Yeah.
then I'm flatter, I'm smoother, my waist is more cinched all the way around. Like they're a thing for a reason.
And also, I have to mention this. So, most women that have a severe diastasis or even like a moderate diastasis, they have an issue with posture because your core is really stabilizing your body and your posture. And when you have years and years of not having any control abdominally with the muscles, and then you get this surgery and all of a sudden you're tight, but your posture is still like your body is trained to like stick your belly out. And
Mhm.
garment really helps you stand straight and it helps with your posture. So a lot of times people they tell me they're like, Steph, oh my God, I just feel more comfortable. My lower back doesn't hurt, my hips don't hurt. I feel so much better. It's because it's maintaining proper posture, which you're trained when you don't have ab muscles, you're trained to kind of like move a certain way because I don't know, it's just the way, it's comfortable for you. But this actually makes you stand up straight, which is great.
I love it. So last question on this topic before we like start a new section. Are there any like misconceptions, myths, like things that you think we should clear the air on in regards to lymphatic drainage massages or garments or really anything in your specialty?
So I think a lot of people, like we touched upon this before, lymphatic massage should not be painful. It's definitely not a pleasurable massage like if you were to get a Swedish massage in a spa, but it definitely should not be excruciatingly painful that you can't get another one. Most of my patients, most people opt to not really take like heavy pain meds and they're able to just take a Tylenol and get through it. And a good practitioner will know how to do a massage without making a lot of pain, creating a lot of pain. If you're getting a massage that's super painful, you're not with the right person. Um,
Very
and
important.
yeah, very important. And as far as compression, I feel like compression is great. Too much compression too soon is not great because I feel like some people think, oh my God, I have to like get in a stage 2 compression right away. You want the blood supply to kind of like start, the capillary supply, I should say, on the surface level of the skin. So you don't want to compress too much too soon. But moderate compression postoperatively the first couple of weeks is okay, and then high compression after that. But too much compression too soon is not good. So that
Totally agree. Totally agree. You don't want to like reduce blood flow to your fresh incisions, but you need to, keep the swelling at bay. So it's that fine line. And that's where like working with your provider and working with your massage providers is going to be so important because a lot of times like they can guide you. I'll see you a week after surgery, but then between week 1 and week 3, you may be able to change into a different size garment. And that's
lots
where,
happens and changes week by
yeah,
week. yeah. And you have to take your journey as individual. Just because your friend is in a stage 2 earlier than you, like every journey is individual. So just do what's good for you.
I love it. Okay. Well, thank you so much for
Um,
sharing your knowledge. This is super important as it's something that, I talk about with all of my patients, and it's something that's very popular today. So, Stefania, thank you so much for your expertise.
Thank you.
Okay, guys, so stay tuned. Next week, we will have part 2 with Stefania from Body Krush in New York City. And we're going to talk a little bit about anti aging, biohacking, and peptides. And if you don't already, please follow her on Instagram at Body Krush, Krush. And I will link her personal profile, her business profile in the show notes. And we will catch you next episode. Thanks, guys.
Thank you. Bye.